p.m. Eastern Time. You have joined the National Reentry Resource Center's orientation webinar for the fiscal year 2019 Second Chance Act Improving Reentry for Adults with Co-occurring Substance Abuse and Mental Illness Grantees. To allow for additional sign-ins past the hour, we will start this webinar in a few minutes. Joining today's orientation webinar for the fiscal year 2019 Second Chance Act Improving Reentry for Adults with Co-occurring Substance Abuse and Mental Illness Grantees. My name is Alexis Lacey. I'm a project manager at the Council of State Governments Justice Center, and I will be moderating today's webinar, which is hosted by the National Reentry Resource Center. Today, I am joined by Andre Bethia. Andre Bethia is the Policy Advisor for the Corrections at the U.S. Department of Justice, Bureau of Justice Assistance. Previously, Bethia served as the Director for Program Operations and Policy at the New York City Department of Correction, where he managed external relationships with community-based organizations and research institutions, as well as developed policy, curriculum, identified best practices, and supervised programmatic activities for adolescents and young adults in custody. As a legal coordinator prior to this, he provided law library research services for individuals in custody at NYCDOC. His career in criminal justice began as an analyst for the New York City Police Department. Bethia received his MA in Library and Information from Pratt Institute and his BA in Criminal Justice from the John Jay College of Criminal Justice. I am also joined by Danielle Brooks, Turnaround Program Coordinator with Presteria Center in West Virginia. Ms. Brooks has worked with the addiction population for the past 8 years in different areas ranging from direct care to therapists at Presteria Center. She has a master's in psychology and is certified addictions therapist in the state of West Virginia. Currently, she is pursuing licensure in counseling and obtaining a doctorate in psychology. Our second grantee presenter is Jody Kane Mallett, Program Director of the New Beginnings Program with the Louisiana Department of Public Safety and Corrections. Mrs. Mallett is a licensed clinical social worker who specializes in treatment of offenders with co-occurring disorders. She has an extensive background in forensics. She started her career with the Louisiana Department of Corrections in 1998. She has held many different positions in the department, including supervisor of the acute mental health unit at Elaine Hunt Correctional Center for Men. She has served many different awards and recognitions during her career, including the Warden's Award of Excellence, Distinguished Service Award, and Best in Business from the American Correctional Association. Mrs. Mallett is presently contracted with the Louisiana Department of Public Safety and Corrections on a Second Chance Act grant as the Program Director for the New Beginnings Program, which serves both male and females in prison with co-occurring disorders. Jennifer Lewis is a State Policy Advisor for the Second Chance Act Innovative Reentry Initiatives with the Bureau of Justice Assistance, Office of Justice Programs at the U.S. Department of Justice. Jennifer has been with the Office of Justice Programs within the U.S. Department of Justice since 2006. She currently serves as a grant management specialist for the Bureau of Justice Assistance Programs Office. In this role, she manages and provides guidance in the administration of Second Chance Act grant funding. And we have Sarah Roseberg, Deputy Program Director in Behavioral Health Division here at the Justice Center. Sarah Roseberg oversees the technical assistance for the Justice and Mental Health Collaboration Program and the Second Chance Act Co-occurring Disorders Grant Programs. She is the lead for substance addiction. Previously, Sarah was a research analyst at the National Association of State Alcohol and Drug Abuse Directors, where she authored research reports and led youth and women's services. To give you an overview of today's webinar, we will do introductions to the Bureau of Justice Assistance, the Justice Center, and the National Reentry Resource Center. Then we will provide more information on the Second Chance Act co-occurring, or as we often call it, the CSAMI grant program, including post-award grant management, and then we'll talk about the Planning and Implementation Guide, and the Technical Assistance Process. Following that, we will hear from 2 grantees about their experiences, and at the end, we will have time for questions and answers. At any time during this webinar, you can use the chat box function at the lower right-hand corner of your screen, and we'll keep a running list of questions, and at the end, we'll do our best to get through as many questions as we can, and we can follow up by email for questions that were not addressed during the webinar. And now I will turn things over to Andre Bethia, who will talk more about the Bureau of Justice Assistance.
Thanks, Alexis. Give us the corrections here, U.S. Department of Justice, Bureau of Justice Assistance, where our mission at BJA is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal law enforcement in achieving safer communities.
Thanks, Andre. Now I'm going to give some background on the Council of State Governments Justice Center and the National Reentry Resource Center, or NRRC for short. The Council of State Governments Justice Center is a national nonprofit, nonpartisan organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. The Second Chance Act, or SCA, which was passed in 2008, supports units of government, state, local, and tribal nations in reducing recidivism and improving outcomes for people leaving jails and prisons and returning to their communities. The SCA has supported over $400 million in reentry investments across the country, and in 2018, SCA was reauthorized to strengthen the initial legislation. The CSG Justice Center currently operates the NRRC in partnership with the Bureau of Justice Assistance, and since 2009, the NRRC has provided technical assistance to more than 600 grantees. There will be a new contractor running the NRRC, the American Institute for Research, in 2020. There are several functions of the NRRC, which is to deliver technical assistance and training for SCA grantees, advance the knowledge base of the reentry field, promote what works in reentry and successes of grantees, facilitate peer networks and information exchange, provide information for people returning to communities and their families. And here you can see a bit more about what the NRRC does, including disseminating the latest news and resources in reentry, and maintaining the National Criminal Justice Initiative's map and directories for state and local reentry services. Here you can see the web address for the NRRC website to access it for additional resources. We encourage you to explore for additional information that can help you in planning and implementing your grant program. And now we'll turn things back over to Andre, who will talk more about the Second Chance Act CSAMI grant program.
I will support it either way so that we can push it out there to more small jurisdictions. Yeah. I'm on.
The Second Chance Act Co-Occurring Disorders Grant Program has awarded over $73 million in funding across 28 states, the District of Columbia, and 2 territories. They have been provided awards to 56 counties, 29 states and 6 tribal nations through this grant program. Within the grant program, there's currently a $12.7 million allocation to support your awards. In total, there has been support through the Second Chance Act legislation for $73 million in awards. This shows you where the different Second Chance Act grant programs are. So you can see it has touched the majority of states in addition to the counties and tribal nations. This is a list of your cohort of grantees who we hope you'll get to know throughout the life of your grant process. For state grantees, there's the Alabama Board of Pardons and Parole, Hawaii Department of Health, Puerto Rico Department of Corrections and Rehabilitation, and Mississippi Department of Corrections. The local grantees are Alameda County Health Care Services Agency, the County of Fulton, County of Los Angeles, County of Weber, Douglas County, Nebraska, Erie County, New York, Miami-Dade County, Pacific County Sheriff's Office, and Pima County. We welcome everyone to the webinar today, and we look forward to working with you to implement your grant programs. For different grantee contacts, there's a couple of different options. So the Bureau of Justice Assistance is your funder, of course, and you have state policy advisors who are actually on the line today in Jennifer Lewis and Andre Bethia, who will be points of contact who will help you throughout the life of your grant. Jennifer specifically helps manage the budget and grant adjustment notices, in addition to all other grants management functions. Andre Bethia is also there to help you as the state policy advisor from the policy side to help with programmatic questions or questions on different implementation issues. The National Reentry Resource Center will be your resource for training and technical assistance. The American Institute for Research will be the support for the NRRC, as we like to call it. And then finally, there is the performance measurement tool, which is how you report back to BJA on your performance in the grant. And through the performance measurement tool, Booz Allen Hamilton is a contractor who works with the Department of Justice to administer this. They have a helpline as well to support you if you have specific questions regarding performance measurements. The program goals for the Second Chance Act Co-Occurring Disorders program. So this is really focused on addressing people with co-occurring substance use and mental illnesses, or what we often call in shorthand at CSAMI, when people are leaving incarceration and entering back into the community. The focus of this is really to reduce recidivism as well as promote public health. The co-occurring grant program really has these 5 main focus areas. So standardized screening within a jail or prison for co-occurring substance use and mental illness, assessments for both criminogenic risk and needs as well as co-occurring disorders, pre- and post-release treatment for CSAMI, and cognitive behavioral interventions to address criminogenic risk factors, collaborative comprehensive case management, which I'll talk a little bit more about later, which really includes thinking through how do you take your criminogenic risk assessment and all this behavioral health information and put it into a plan that helps reduce recidivism and promote public safety and public health. Additionally, there's the performance measurement piece. So a big part of this grant is working towards evaluations and really being able to show that the work you're doing is reducing recidivism and supporting safety in your communities. There's 2 different phases to this grant program. The first phase is the planning phase. You'll receive intensive technical assistance during this phase, and you can use up to $150,000 to complete and submit the required planning and implementation guide. We'll go into some more details a little bit later on the webinar on what is in the planning and implementation guide. The guide will be provided to you by the National Reentry Resource Center, and it will be completed in coordination with your technical assistance provider. You have up to 12 months to complete the planning and implementation guide and to move from the planning to the implementation process. Key pieces of the completed guide are a plan on how you're actually going to develop standardized screening and assessment for people with co-occurring substance use and mental illness, and how you're going to work collaboratively and comprehensively to develop case plans for the people within this grant program. Another piece, which continues to be important, as I had mentioned, was performance measurement and evaluation. So the Department of Justice would like to see a plan for performance measurement and evaluation that includes solutions that will be tested, different evaluation metrics that you might look at, and documentation of the research base for your proposed interventions through the grant program. So in the planning phase, there's a number of different allowable costs, and these will probably look familiar to you from the grant solicitation. So the first piece of it is completing the planning and implementation guide, as we just discussed. Another major piece of the planning and the implementation phase is in convening advisory group meetings. So really getting a cross-system stakeholder group from criminal justice and mental illness and substance use together to really talk about some of the issues that are happening and to help with oversight of the grant. We recommend having high-level officials involved in this process in order to better support the work and help with future sustainability. So through that, you can work during the planning phase to convene those meetings to help with the planning and implementation guide, but also to make sure that you're going in the right direction that makes sense to those stakeholders. Another big piece of it will be outlining the screening and assessment processes. So a lot of the initial conversations are, how are you actually working to identify the target population that you laid out in this grant? And oftentimes people put a specific number of people they were planning to serve. So how are you going to get referrals and actually reach that number? Additionally, it's really creating protocols for case management. So how can you coordinate between the jail, community supervision, and a community-based behavioral health provider in a way that makes sense for everyone and really creates the idea of a plan that goes across different pieces to support that person in reentering. Information sharing protocols are another big piece of this. So developing memorandums of understanding or policies on what information can be shared across that group who's coordinating on the case management and what makes sense to your jurisdiction. Many of the grant programs use this time, if they have not already, to select evidence-based practice to address criminogenic risks, mental illnesses, and substance addiction as well. Another big focus we've seen from grantees in the past has been use of pharmacological drug treatment services. So that's often through medication-assisted treatment for addressing alcohol use disorder and opioid use disorder. Another piece of this is coordinating recovery support services that are available both within the correctional facility and as people reenter. So whether a peer specialist is able to do in-reach into a correctional facility, for example, or other supportive housing services, vocational and employment services, and education that's available in the correctional facility and the community. And of course, as we already discussed, really beginning to think through what are the key metrics of success that your jurisdiction is going to utilize for this grant program, and how can you track success, and what are the plans to collect data for your evaluation. So as you move to the implementation phase, you'll notice a lot of this builds on the work of the planning phase. So really continuing to engage leadership. So having that advisory board group continue to meet and update them, ideally with progress and data if you have that available, to make sure people are abreast throughout the time of the grant of the different things that are happening. you begin to actually screen people for the co-occurring substance addiction and mental illnesses and monitor the screening process to make sure that you're able to bring it to scale. So ideally screening everyone who's coming into your jail or prison. There's a big piece in terms of trying to develop quality assurance processes. So as you get further along in implementation in year 3, for example, making sure that you're still implementing the screening tool in a similar way that you did to year 1 or that you've improved your practices. In conducting assessments, making sure there's standard policies in place for that as well, for both criminogenic risk and needs assessment as well as CSAMI assessment information. And really making sure there's coordination across different people who might be working with the grant on behavioral health issues. So oftentimes there's a focus on how correctional health providers, community-based providers can better coordinate to share information to make the handoff a little bit easier for everyone involved. So providing collaborative, comprehensive case management is a big focus of this grant track, and the tool that we'll talk about later, we actually developed for this grant track specifically. We'll be working to make, the TA provider will work to make sure that the partners are connecting pre and post-release to have continuity of services and a plan that really builds upon itself. The information sharing piece will continue into the implementation phase as you start to get a feel for the information that would be useful and refine some of those different aspects as you begin the case management process and as you begin referring to different potential providers. Each of the programs will have selected different evidence-based practices, and a big piece of this will be then working towards implementation. So sometimes that involves additional training, or you might be using an evidence-based practice that already exists in your community. So there's lots of different options for continuing this work and making sure you have a process to ensure that the implementation is following the evidence-based practice to fidelity. The continuation of thinking through and supporting recovery support services. So sometimes as grant teams do this work, they actually come up with additional recovery services that are available in the community that they can additionally add. So it's really important to continue to look at the full range of options. The housing piece is certainly a popular piece in terms of what's available and what can be accessed. There's also the opportunity through the planning and implementation guide to provide a logic model. So really making sure you have the program plan set out through a logic model that can also inform some of the performance measurement and evaluations. So during the implementation phase, there's really going to be consistent conversations on performance measurement. So in addition to your performance measurement tool, you'll be working with the evaluator to develop and implement the plan and making sure that you have what you would like to track laid out. So including recidivism reduction, but also behavioral health outcomes, outcomes of recovery support services, outcomes of community supervision if a person is on probation or parole. So really making sure it's comprehensively looking across the program. The SCA CSAMI awards for this year is up to $1 million for a 48-month period of performance, which began on October 1st, 2019. Please note that there is a cost sharing or match requirement with the grant this year. Now I'm going to pass it over to Jennifer Lewis to talk about post-award grant management and provide an introduction.
Hello, everyone, and thanks for participating. Again, I'm Jennifer Lewis, the BJA Programs Office State Policy Advisor for CSAMI. I'm your contact for all things grant management related. I'm going to quickly discuss some important items to remember now that you've received your award. Please take note of the special conditions that are included in your award notification package. Special conditions are included on all DOJ awards, so please read through each one carefully as each condition includes specific requirements. Most importantly, you will need to pay attention to any withholding special conditions that may be placed on the award. These withholding special conditions place holds on funds for overdue reports, pending budget approvals, or other programmatic requirements, including missing documents that were not included as part of the application. This grant includes a withholding for the development of the Planning and Implementation Guide or Action Plan. So please make sure to work closely with the TTA provider to complete the guide. Submission of the final guide will need to be submitted to BJA for final approval and the release of this withholding to access implementation funds. You should notice a withholding for conditional clearance for budget approval. At this time, there is a delay with our financial office for budget reviews, but they're in the process of reviewing budgets now. You'll be notified via GMS if your budget is approved, or I will be contacting you directly if there are any issues or questions that need to be addressed. You're required to submit quarterly progress reports under the BJA Performance Metrics Tools PMT system. This is to be submitted in PMT only, and here we provide the dates and the link here. Semi-annual progress reports are due in GMS on January 30th and July 30th. This means that you'll need to download the semi-annual report in the PMT system and upload it into the GMS system. Unfortunately, the two systems are not linked. Please note that GMS automatically freezes funds for any delinquent reports, so it's important to submit these reports on time. You are also required to submit quarterly federal financial reports, or SF-425, under the GMS system. We have provided the reporting dates and the links here. Because there may not be any activities at this time, please submit the first report as zeros. The award period began October 1st, so report 1 will be due January 30th. And this is for the reporting period October 1st through December 31st. And then please note that GMS automatically freezes funds for any delinquent reports. So again, it's important to submit these reports on time. As part of the special conditions, grantees are required to complete the grants financial management training. This is required for the point of contact and the financial point of contact listed in GMS. Please make sure the contact information in GMS are correct. You can complete this training one of two ways. You can complete it through the 24-module training online, or you can complete it at our location in Washington, D.C., and then this in-person training gets filled very quickly, so please make sure to register as early as possible once you receive an email notification when it becomes available. You're allowed to use grant funds for this training if needed, and recertification is every 3 years. Grant Adjustment Notice, or GANs, are used to request for any project changes or corrections. This is to be submitted in the GMS system for review and approval. And here we have examples such as budget modifications, scope changes, project periods, changes, change of contact info, program office approval, to name a few. And GANs will not be approved if BJA reporting requirements are delinquent. And here's some helpful links to refer to. And if you have any specific questions pertaining to your grant award, please feel free to contact me directly. I'll be happy to assist you. And this concludes my portion of the presentation, and I'll hand it back over to Alexis.
Thanks, Jennifer. We're going to turn it over now to Sarah to discuss the Planning and Implementation Guide and the technical assistance resources.
Thank you so much, Alexis. So just to note that the role of the NRRC, or the National Reentry Resource Center, is going to be transitioned to the American Institutes for Research, or AIR. I'm going to tell you a little bit about the Planning and Implementation Guide. So as you saw from the description of the planning and implementation phases of the grant, this is part of what you have to do in order to move from planning and implementation. And this guide was really developed to outline some of the key questions and processes that we found grantees were consistently running up against. So hopefully the process will be useful to your team. It's really meant to identify your successes, your challenges, to give the TA provider a greater sense for some of the goals that you might have as a jurisdiction or areas that you would like to do deeper dives on technical assistance, whether that be on your screening process or selection of screening tools, or a broader topic such as addressing trauma-informed care in your correctional facility. There's a variety of different things that you can get resource on. It's also meant to really focus on helping you as a jurisdiction have critical discussions, which then can identify additional needs that you might have. For the TA provider, it also creates an opportunity to figure out different options for peer-to-peer learning. So in going through this process with multiple grantees, there may be the ability to connect you with another grantee in the cohort or a past grantee that could be useful and has dealt with some of the issues that you're dealing with. It really enables the exchange of ideas and reviewing of best practices. And BJA utilizes this to get a better understanding of your grant program. So once you finish developing this with your TA provider, BJA actually reads reviews and approves it, and in some cases they may have additional questions that they'll send back for clarification. The different sections of the Planning and Implementation Guide. So the first is getting started and identifying goals. So this is really about what is the broader goals and visions of the grant program, and have there been any changes since the proposal was written, making sure that it's clear who the points of contact are for the grant and getting some background information that will help in the technical assistance, including doing some outlining of your advisory board as well. The next big piece is a really big topic, which is defining or refining your target population. So how are you going to actually serve the people with co-occurring substance addiction and mental illness in your jurisdiction? Making sure that there's a plan for how you'll get referrals, for how you will conduct the screening processes and assessment processes that are necessary. Section 3 is talking about the evidence-based services and supports. So these are the different evidence-based practices that you might be doing, talking about who's actually implementing them and how you're implementing them. So let's say you are doing seeking safety and it is a case manager in the jail who's implementing that. That's the type of information you would provide, in addition to recovery support services. Section 4 really goes through the collaborative comprehensive case planning model and talks about different post-release supports, including supervision strategies for those on probation and parole. Section 5 is focused on a topic which you've heard a couple of times during this webinar, which is quality assurance processes. So how do you make sure after you've selected the evidence-based practice or your screening tools that you're really doing those with fidelity and keeping a process in place that makes sense? Section 6 is on data collection, performance measurement, and program evaluation. So this section is typically filled out in partnership with the research partner to make sure that you are in agreement with what is going to be collected, how you're going to go about doing that, and thinking through what type of evaluations you'll actually be doing if that hasn't already been determined. Section 7 is a conversation that is really ongoing throughout the life of your grant, which is how do you sustain the grant program? What are opportunities in your jurisdiction to leverage current funding resources or to get additional funding through other state or local sources? The appendix has resources on all of the different sections that I've already discussed. So this really has links to different resources such as webinars, publications that can really help give you background to completing any of the sections. So we mentioned before the collaborative comprehensive case planning tool. And this was really developed for this grant track to address criminogenic risk and behavioral health needs. So it's an interactive web-based tool that has a video that talks you through some of the processes. Then as you can see, there's different questions that are answered on the website, such as what are the collaborative comprehensive case plans? There's actually 10 different areas that are outlined that you can, and questions to ask in your jurisdiction to try to make sure that you're coordinating. And then there's also different examples from different sites. So before this collaborative comprehensive case management model was developed, the Behavioral Health and Criminal Justice Framework was developed by the Council of State Governments Justice Center in partnership with the Bureau of Justice Assistance. And this is really a way to think through the different target populations. So looking at first developing risk assessment, and are you targeting low or medium high? For this grant program, you'll really be focused on the medium to high risk people. Then looking at the substance addiction piece. So do they have low or medium high severity substance use? And then looking at their mental illnesses, whether it's low or medium to high mental illness, and making sure that you have a definition of who you're trying to serve in this grant program. Generally, it'll be groups 6, 7, and 8. So further to the right of the screen is the target population that folks use for this grant program. So these are the 10 different categories that are addressed through the collaborative comprehensive case management model. So within the web tool, you can click on any of these links and it'll actually provide a drop down with additional information and resources for you to discuss. On the right, you see this wheel that says Lead Case Planner Correctional Facility. So a lead case planner could be different agencies. So the correctional facility could be really managing the case management process. It could be community supervision, so probation or parole. It could be a community-based behavioral health provider. In some cases, it's actually a different separate case management agency as well. But for correctional facilities, community supervision, and behavioral health providers, we have different examples on the website. And each of these sections on the wheel, such as peer support, for example, you can click on and it'll give you information on things that are commonly shared with peer support and what they can share with a correctional facility potentially, as an example. So for each of these, there's a different profile. So this is the lead case planner profile for Franklin County Sheriff's Office, which is a rural former grantee in Western Massachusetts. So it gives you some information about the population for that grant, and then there's a whole feature that discusses how they address some of these critical issues, such as coordination efforts, staffing, and training. So we think that you'll find those really useful. Try to look at the lead case planner profile that best matches what your grant program has laid out, and there are some really good examples there. There's also webinars that each of the lead case planners have led, so you can hear a little bit more about best practices for 3 sites that are really doing a great job of this around the country.
Thank you, Sarah. Now we'll hear from Danielle Brooks and Jody Kane Mallett, who will discuss their experience as CSAMI Grant Award recipients and provide some tips on how things they wish they would have known before receiving the grant award.
Hello, I'm Danielle Brooks, and I do the turnaround program in Huntington, West Virginia through CSG Center. We primarily work with the senior population. When I was brought onto the project, the majority of the P&I was already completed with the other grantee teams. But one of the things we kind of ran into was some state changes that happened in the state with the jails. They merged, and also having to open it up to not just convicted misdemeanors, but also the entire misdemeanor population. So those were some changes we definitely had to make. And some of those changes are still we're still adjusting because the time now, misdemeanors are actually getting counted day by day now. So even if they're supposed to serve 6 months, a lot of times they're almost already out because their time is getting counted. And one of the things that we are now kind of looking into is trying to open it up to getting families involved. And I think we would have loved to kind of look more into utilizing more resources on how to extend it to getting the family members involved and knowing what we can offer them and helping them out to get involved, because we notice when we have family who's involved with their loved ones that are in our program, we have a better success chance of getting in contact with them as soon as they're released from incarceration unexpectedly and assisting them get into treatment or other needs that they have.
Thank you so much, Danielle. I think we will now go to Jody Kane-Mallett, who's going to talk about the program that they are developing in the Louisiana Department of Public Safety and Corrections.
Hello, good afternoon. Yes, our program started in 2011. We received our first grant award. I was not with the program at the time. We're now on our third grant award. We received another one in 2014, and we expanded our services and then we received this one in 2018, and we're further expanding our services. I just completed the planning and implementation guide, so I've just started enrolling participants at this time, and I'm working on hiring right now. So we aren't officially up and running. I mean, kind of, I guess. We have some intakes done. But the main thing, I think, is to learn from your mistakes, because you will make them. I mean, we have come so far, and just every time that, something happens, we learn from it. One of our major successes is in having peers involved. I think you definitely need to have peer support to be a successful program. Someone with co-occurring disorder is going to relate better to someone else who has a co-occurring disorder. And in our case, someone with a history of incarceration as well. We found that that was like one of the main reasons for our success. Also, hiring the right people. You've got to figure out who the right people are for the positions, and make sure that you have a good team going in. And then as far as completing the planning and implementation guide, it's really it's very comprehensive, kind of laid out for you. You can just kind of follow that, and if you have any questions, just reach out to your technical advisor. They're there to help you. Be prepared for the monthly calls and have your questions ready. It's a good opportunity to learn. And, just reach out to people. If you need help, reach out to, someone, a previous grantee or someone who's a grantee with you now, and everybody can learn from each other. It's really been a good experience for us.
Okay. Thank you.
Anything else you want me to talk about, Sarah?
That was great. Thank you for the tangible examples.
Great. Just want to say thank you to Danielle and Jody. Now we'll have some time for questions and answers. You can utilize the chat box in the lower left-hand corner, or feel free to unmute yourself to ask a question.
Okay, so there have been a couple of questions that were chatted into the chat box. And one of them is a bit specific on someone's budget approval, so we really encourage you to reach out to Jennifer if you have been asked to provide some additional information or to resubmit your budget. Jennifer, do you have anything to add on that? Okay, so
Hello,
another question. Oh, now we can hear you.
Oh, sorry. Each grantee has a specific budget that might require different additional information, so feel free to contact me directly, and I can assist you with any budget questions or issues with any changes or so forth.
Thanks so much, Jennifer. That's really helpful. Jennifer will be a great resource to you throughout the life of your grant, for sure. Another question that we had is, are we required to use the collaborative case management tool for case planning development? So the collaborative comprehensive case planning tool is not a case management system. So I know some of you might use different case management systems. That's not what this is. It's more of a process for discussing how you're using the different assessment information together. So how you're actually looking at behavioral health and criminal justice indicators and using those in tandem to better support addressing criminogenic risk factors as well as behavioral health needs. So just wanted to make that point of clarification. And there is a section of the planning and implementation guide that will help walk you through this process, and the web-based tool is meant to be a resource, but it's not a system in which you input information to. So I certainly want to make that distinction for everyone, and thank you for the question. Another question will be, when will we have access to the planning and implementation guide? So I think that is a good question. So that guide has been approved by Department of Justice. And so unfortunately, Andre had to hop off the phone. So we can get back to you in terms of the answer to that question, but there is a guide that's been approved that has some updates from last year. The next question is, when can the grantees expect to hear from their technical assistance advisor in consideration to the AIR transition emphasis? So Jennifer, I'm not sure if this is one that you're able to answer, or if this is another one that we can have a list of follow-up questions as well.
Right. So my meeting with the policy office, they said that you should receive some type of correspondence in January regarding the next steps. There's no specific date.
Okay, thank you so much, Jennifer. That's super helpful. If you have any more questions, feel free to chat them into the question and answer box at the lower right-hand corner, and we're happy to answer those. I have another question for Jody Kane-Mallett. So Jody, part of your previous 2 awards from the Louisiana Department of Public Safety and Corrections involved evaluations. Can you talk a little bit about your work to develop an evaluation partnership and what you've gotten in return from that partnership?
Yes, so that was all set up before I came on board. We worked with Turnaround Life with Peter, and he did outcome and process evaluation. We also did like some client satisfaction surveys, and I really don't even know that all of the data is finished from the last grant, but I do know that we had like a 25% reduction in recidivism. And when we started our program, they did a study. They just picked 100 co-occurring offenders, and they were going to follow them for a year and see how many had been reincarcerated. Well, they only had to follow them 6 months, because at the end of 6 months, they were all back in prison. So, yeah, it was kind of shocking.
certainly
that
very
answers
important.
the question. Go ahead.
Yeah, it answers parts of it, and I think even now in your current process for the planning and implementation guide development, you had been working with Dr. Gamache on developing some of your metrics and really outlining what would be helpful to different clients.
Correct, and then I'm also trying to, there's just some data that I want to capture that I'm trying to set up a database for that now, and not having much data experience, relying on other people for help. So, yeah, it's very important to know what you want to capture so you can get it from the beginning, because going back and trying to input it later is definitely difficult. That's one of the lessons that we learned.
Absolutely, thank you. And another question for Danielle. So Danielle, I think one of the interesting aspects to your program is that you all are working in a regional jail facility and you're working with misdemeanor clients, which some programs aren't focused on. Can you talk a little bit about your process in terms of being able to engage people in the grant program, which I think your group has done very successfully?
Well, in the beginning, we were just doing it just volunteers, so they were volunteering through the kiosk in the jail. But now we actually go in and we look at the most recently incarcerated misdemeanors, and we actually pitch the program. So like even this morning, me and my team went in, we pitched the program, what we can do, and we had 7 participants who agreed to participate, which will then schedule them to do their intake. We had to learn how to kind of change up our method to include more people and let them know what the program is about.
Yeah, thank you. I feel like your team did a good job of learning as you were going along in the process and making some updates, which I think is important for all grantees to figure out how to be flexible. As we implement, they often don't, things go a little bit different than we expect. So if there are any additional questions, feel free to chat them into the chat box on the lower right-hand corner or unmute your line and you're free to ask questions as well. Okay, so I'm going to hand it back to Alexis to go through some supporting resources.
Thanks, Sarah. On this slide, you will see these are some key resources for the CSAMI grant track that you will be referencing during your grant period. And here are some links to financial information for your grants that will support the information Jennifer provided and are some of the most commonly used links for grants management. Here is the contact information for the policy advisors with BJA who you can reach out to if you have any questions. You have Jennifer Lewis and Andre Batia's information here. Finally, I want to say thank you. Please subscribe to NRRC, Behavioral Health, and other newsletters. We look forward to working with you, and the webinar will be recorded and posted to our website. Thank you.